3, 2, 1, you're live.
Hello, everyone, and welcome to the VUU. I'm Michael Tino, and along with Quiana Perkins and Don Fortune, I am one of your hosts of this fine episode. I am joining you from Peekskill, New York, where it is a beautiful sunny fall day. It has actually turned autumn in New York, and I am thankful for that. My child is at school, so I am joining you from the downstairs office where we will not be interrupted by a 7-year-old who was wondering what daddy is doing on the computer. So that's where I am. Quiana, how are you this morning?
Ooh. Just had to do that first unmuting. I am doing quite well here in Ann Arbor, Michigan. I don't know if Michiganders have an accent. I'll have to study that. It rained here yesterday, so it made it a little bit harder of a day. But today, just enough sun peeked out. I took a beautiful walk and got to just kind of take in the change of seasons, which was beautiful. And I will admit, I turned on my heat yesterday. I'm proudly now at 68 degrees, which feels much better than the 64 I started at. I will pass the mic to my friend Don to talk about where they're calling in from.
Hi, I'm Don Fortune. I am here from, where do I live, right? It's one of those. Egg Harbor City, New Jersey, which is this teeny little town with neither eggs nor harbor, and 4,000 people, I think, hardly makes a city, but here I am. It is a beautiful fall day. For reasons unknown to me, every one of my neighbors seems to be mowing at this moment. So I want to have the windows open to get the air, but then I wouldn't be able to hear myself think. So it's a beautiful day here in South Jersey. I'm excited to get my forge back up and running this week. So that's making me happy. We're gonna mention, I guess, that that we have somebody behind the chalice. You want to take that, Michael?
Sure. Tanner Linden is our communications coordinator, and he is behind the chalice. I don't know if you all see the little chalice logo that Tanner is behind, but he is monitoring your conversation on YouTube and getting us any questions and comments that you have so that we know we can actually have a conversation with our live viewers as well. And for those of you who are joining us by
Did Michael cut out for everybody?
Yeah, Michael cut out for everybody.
Oh, I bet he's switching headphones, so I'm gonna speak.
The battery ran down. He didn't let it charge enough.
So one of the things, like this is live TV. Thank you, live TV. So one of the things we do before we head into the gumbo of this all is looking at a roundup of things that are happening in UUAA land. So I work at UUAA, and our denomination is UUA. So if I slip up on my extra A's, I apologize. We want to just do a roundup of things that are happening. I wanted to speak really quickly to Blue Worship happens this evening. If you are a part of the closed circle group, you can definitely get the link for worship there. It's going to be at 9 o'clock Eastern time. And that we do that to help our siblings who are on Pacific time have a little early worship sometimes too. And then if you have a Black child and you want to engage them in faith education that is African American Black centered, Blueberries, which is also run through Blue, happens. Our open house and beginning of season starts on Saturday. So we hope you're able to join us. It's at 2 o'clock Eastern time. I like to be really clear about time zones. But I think there were some other ones Michael was going to mention as well, some other opportunities coming up.
Yeah, all sorts of things happening recently, and my batteries are at 51%. It just disconnected, and I don't know why. That is sometimes technology. Uh, Drum, Diverse Revolutionary Unitarian Universalist Multicultural Ministries, our fabulous organization for Unitarian Universalists of color, is having a virtual fall gathering coming up, and Tanner's going to put the links to that. It's October 9th to 11th. Tanner's going to put the link to that in our YouTube. Loretta, the Liberal Religious Educators Association, is having their annual fall con at the end of October. And I hear that there is a discounted registration rate available through the 8th of October. And can someone remind me what the fabulous programming is that I really mean to sign up for? Because every time I hear about it, I go, oh, I need to take that.
They have not introduced the schedule quite yet, but I know that it has been a fabulous conference for such a long time that I am stepping out on faith and planning to attend, even though I don't know the content. But I trust the people. So we're just going to step out on faith and trust and know it's going to be an amazing opportunity to learn how to be fearless faith educators in our community.
Oh, I thought they had announced who like the major presenters were going to be, and it sounded really
They may
fabulous.
have, and I may have missed that.
So like if you're a Loretta member and you're watching live, put it in the YouTube chat and Tanner will let us know. And also I want to mention the Church of the Larger Fellowship is raising money right now for our prison ministry. Those of you out there might not know that we serve over 1,200 incarcerated Unitarian Universalists. It's people who are currently in prisons all over the country, who are Unitarian Universalists and participate in our congregation. And it's a labor-intensive, life-saving ministry that folks do at the Church of the Larger Fellowship. We invite your congregations to connect with it and let us know if that's something you want. But go over to Faithify if you want to help support that ministry. We have blown past our original goal thanks to some really generous donors out there, but we made a stretch goal. And to be quite honest, the prison ministry costs us almost $200,000 a year. So the $20,000 goal is just a drop in the bucket to get people more involved in it. And our incarcerated Unitarian Universalist members aren't able to contribute toward their ministry. So we rely on other folks to do that. What am I missing in the UU roundup? Dawn, you have anything for us? Nope. Quiana? I'm still here, right? Okay. Whew. So let's get into our topic. So I don't even remember what we called today's show, public health and ministry and something. But we have two fabulous guests with us today. Dr. Ross McKinney is a nearly lifelong Unitarian Universalist who I have known personally for almost 30 years. It's weird to say that. Ross is an infectious disease expert. He was on the faculty at Duke University Medical Center way back when I met him at the Eno River Unitarian Universalist Fellowship in Durham, North Carolina. And right now he is the chief scientific officer for the Association of American Medical Colleges in Washington, DC, though he still lives in Durham, North Carolina. So it's great to have you here, Ross. And we also have the Reverend Manish Mishra-Marzetti joining us from Ann Arbor, Michigan, where Manish is the senior minister of the Unitarian Universalist Church Congregation, something. What is it, Quiana? Of Ann Arbor, Michigan. Manish is a lifelong learner, scholar, author, and UU leader. And most recently, co-editor of Justice on Earth, People of Faith, working at the intersections of race, class, and the environment. But there's so much out there that Manish has contributed to Unitarian Universalists. So it's great to have you here too, Manish. And I will admit, this show today was in part Dawn Fortune's idea, because they said, Michael, Tino, we need to make sure that everybody in Unitarian Universalism understands that you have a doctorate in cell biology from Duke University. Because we were talking about what it means to make decisions for our congregations based in the emerging science on coronavirus and COVID-19 that keeps our congregants safe and healthy and responds to the needs of people, the very human needs of people to be together, which we really, we can only be virtually most of the time. Dawn, do you want to say a little more about what you're hoping we'll talk about today? Because it was your idea.
It was my idea, yes. So my thought was, and we had this conversation sometime over the summer, and my thought was, we have so many congregations that are struggling with various levels of understanding and various levels of anxiety around the coronavirus and the level of how infectious it is and how it's transmitted, and there are so many conflicting reports. I don't even want to call them reports because that sounds official, but there's reports and then there's theories that may not be based in reality or science, but there's so much information and misinformation that our people really don't have great information on which to base their decisions unless they happen to be scientists or physicians, and here we are, as I am as clergy, trying to help my people make decisions and alleviate the anxiety as best I can, but I need good information, and we need to talk about what's safe and what's not safe, and how do we balance people's need for connection with the risk that comes with that connecting, and sort of how do we walk that fine line. And I wanted us to be able to take this time. My dream from this thing would be that we all come out of this with a simple understanding of a very complex subject that we can then tell to our people, and they will understand and say, oh, okay, and then we can all know what to do. So can you do that?
And from my perspective, so my role in my building is Congregational Life coordinator. So how do I take this information that's very kind of heady sometimes and bring it down to groups or people, or make it real time? And then there's this other piece that I'm hoping Manish can speak to, which is how do you bring your community into a digital year? How do you use science to help folks understand what needs to happen next? And I have some questions around what does it impact that we don't realize, right? So I forget that COVID is going to be directly connected to our stewardship campaign and how it needs to look and feel different, how money raising is going to look different. So I guess for me, I'd love to talk a little bit too about how this thing that science is impacting the social, kind of this whole other realm of things that I didn't even realize it was touching, but that are integral. So that my hope is from much more of a touchy-feely kind of way. I think they used to call it soft science kind of thing. Where does soft science and hard science become reality?
Excellent.
And
so
you've got about 40 minutes. Can you do that?
We get to solve all of that in 45 minutes. There we go. So Ross, maybe we start with you, because you've written op-ed pieces that many of us can go out there and find. Where do you start when trying to tell people what you know about the emerging science? And I know it's new papers every day surrounding coronavirus.
I usually start by saying, yeah, it's real, it's serious. And what's made it such a big problem is the fact that the virus is spread when people have not yet developed symptoms. So you have to be concerned about the person who looks well in front of you being the way that the virus is being conveyed. And when the other thing that I'm constantly asked is, what is an okay risk? What are things that how is it really spread? What are okay risks to take? You know, can I get in a plane? What about my grandmother who is 91? How secure do we have to be? You know, can we go to the grocery store and go see grandma? Can we go to the theater and see grandma? Can we go to one of the restaurants that are now open indoor and then go see grandma? All those are the kinds of things, because it's a relative risk equation and it's a complex one. And most people don't have the background to be able to weigh those various factors. So I spend a lot of time answering specific questions for people. And, you know, for example, I reviewed our congregational plan for how we met. And when we decided we weren't going to be able to meet, that we were going to go virtual, and what would be allowed in our building, and what would be the constraints on using our building at Eno River. So it's these are complicated times, and a lot of what I do is explain the complexity.
What are some of the questions that you would counsel congregations to be asking with regard to this right now?
Well, I think what everybody really wants to know is, when are we able to get back together again? You know, and we don't know. And I think that the best guess is that will probably be sometime after Christmas. We don't know for sure, but that's probably our best guess. And so it's going to be, you know, we're going to see what happens this fall. And there are already hints that we're going to have another wave in the fall. Normal respiratory virus pattern is that they're worst in spring and fall and through the winter. And so we are now going into what is normally respiratory virus season. So, and Europe is already seeing it. So there's reason to be concerned that it's going to be a while before we're able to get back. When we get the vaccine, which everybody is looking forward to, that's going to affect the ability to get congregations back together again. You're still going to have to make sure that everybody's gotten both doses of 4 of the 5 current vaccines that are in studies. They'll require 2 doses to get to full efficacy. So you won't want to go out into the world until you've had both doses, and then a little bit of time to respond. So it's probably a 6-week matter from when you first get the vaccine to when you're protected. And they're going to have to distribute the vaccine all over the country. And they should begin with older folks, with people who are in the front lines, be that school teachers, be that people who work at McDonald's, be that people who are, you know, have to be in buildings, have to be in stores. Those are the kind of people who can stay at home and have the money to stay home and work by Zoom. Those should be the last people to get the vaccines, because they can afford to wait. So we'll see how the vaccines get distributed, but it's going to take a long time to make enough of it, if it works, and then to see, even when we start giving it, to see that 6-week to 8-week period before people are given permission to go out into the world.
Manish, I'm wondering, I want to bring your voice in here. What are you experiencing in, you know, in a congregation, a fairly large congregation? What are people saying? What are people asking? What are people nervous about?
You know, I'm glad and grateful for how Don and Michael and Quiana, the 3 of you, framed the conversation today, because it helped a couple of things crystallize for me. I mean, so, you know, since the outset, I'm clear that we're the religion of Joseph Priestley and all kinds of lauded scientists who've been leaders in our movement, right? There's no ambiguity in my heart or mind that we are the people who have been standing up for decades, if not centuries, for the possibility and or the reality that science and understandings of ethics and faith are totally compatible, and in fact should cohere. Like, we need a coherent view where all these things mesh. And the life of community is not science-based alone. So that's where the complexity comes in, right? And so I was scribbling some notes as you all were talking, and we've got three things intersecting, and in a way, they all matter. So there's the pastoral, which also for me, more simply, you could just say emotional. There are emotional things which are pastoral in community that require some kind of pastoral response. There's structural issues. So I'm an institutionalist. I have spent 20, 25 years in Unitarian Universalism trying to build up things that can last and endure into the future. And the structural issues are, so first before I leave pastoral, grief, right? In the early days, my God, it's still there. The profundity of the losses, small and big. I mean, most recently, those of us like Michael, you and me for sure, putting our kids in virtual schooling at home, the immense sense of loss around needing to prepare for that, navigate that on a daily basis, right? Grief, it's still there. It moves and feels differently than it did back in March, but it's still there, definitely. Then there's this loneliness. I have people telling me about elders who they've actually almost been in isolation for 6 months. Family members can't even see people, right? And so there's this profound, from that example, which is kind of an extreme example of loneliness, to even just, I'm lonely and I'm an introvert, I miss hugging people that I'm close to. I really miss it. I miss the energy of Sunday morning. I miss it more than I have words for. I miss it so much. And then there's this interesting thing. I had people back in the early days of the pandemic, they were writing to me and saying, we really need, this was April or May, people writing to me and saying, we need to reopen. I'm of a demographic, an age, and a group, I'm not gonna come, but we should open. And I had to sit with that, and I was really confused. I was like, what is going on? I don't quite understand this. And what I started to understand, there's this desire for normalcy, right? Nothing in our culture, our civic life, our day-to-day life has felt normal to folks. So you've got the grief, you've got the loneliness, and can we just go back to something that feels more familiar? Even for folks who are saying they're not going to show up in person because their health situation, their age doesn't allow it, they're still wanting some things to feel a little normal. All of us do. I do too, So there's the pastoral and emotional stuff. Now the structural. Every community, we say, we're the people of democracy and all that, but what that actually means locally is very different community to community. There's the formal power structures, the way things are written down that they're supposed to work. Then there's informal power structures. In any human community, that's normal. And the balance between whether it's more informal power or more formal power, that's also different community to community. So if a community was struggling, there's a lot of informal power, 2-3 people decided everything, that's the way it's been, and we've been trying to figure that out, navigate that. It's been that way for a long time. That's still there. That hasn't gone away. And if it was more so that there's formal decision-making, there's large group consensus, community consensus on how the formal structures mediate complex decisions, that's still there, and that's working. And if it was confusing and unclear somewhere in the middle, guess what? It didn't magically get solved. You're still in the middle of unclear decision-making processes. So you've got the pastoral intersecting with the structural, intersecting with the science. And that's what's making this very complicated at the local level.
Woo, that was a lot, Reverend Manish. It was a lot though, because I think we as a denomination, we love science. I think you're absolutely right. We love all of the beauty and knowledge that someone like Ross possesses, but we don't always know how to translate it into making good choices. How is your community or the communities that you work in taken to this kind of commitment to having a digital year and not committing to a time frame to come back? And I know that because for full disclosure, I work with Reverend Manish on a day-to-day basis. I don't want that to seem like, any other thing than me asking my boss, how does it look when you're saying to folks, we don't know when we're coming back? How does that making that decision feel, and how does it look like to prepare a community that longs to be together, to not be together, but be together differently?
Well, so Ann Arbor is a university-based town. That is the primary industry in the town that we're in. honestly, that helps. That helps a lot, because if we don't actually have, we actually have academics, but even everybody else is academic adjacent in a way. And so like that commitment to those processes, the rigor of the scientific method, not only do our community members kind of automatically follow all that, they're invested in it, they care about it. So that's actually made it a little easier, I think, on one hand. On the other hand, I'll speak frankly, like I'm so grateful for our president of our denomination, like back in the late spring, putting out there, prepare for a digital year. That was received with a lot of shock, but in every quarter I heard, from me too, honestly, I was like, what? Susan's saying this? Great, good for her, because I don't know that I can say it, right? Even if I've had the idea, I don't know that I can say it, because the community's not there. So that's actually the thing. Like, those of us who are trying to navigate leadership positions, we are trying our level best. It's imperfect to look out ahead, to project out as far as we can with care, the care of the whole community in our hearts. And a lot of our community members are not in that same place because there's grieving going on, there's loneliness, there's a deep heartfelt desire for normalcy, whatever that means and looks like. Folks are at different places of processing what today means, right? So if we think back to March or April, nobody was thinking we had 18 months of essentially like working from home and not, nobody, I wasn't thinking that. We were thinking, even in the leadership of Ann Arbor, we were thinking, oh, this is 8 weeks, 10 weeks, 12 weeks. We weren't thinking 18 months. So just if we hold that, like there's an evolutionary process through this related to how much we're able to see and how much we're able to hold. Given that, I have encouraged the leadership folks that I work with, like we have gone slow. And we have almost to the point where like, it's like, let's let the local institutions, like the public schools, let them fully make their decisions. Let them fully announce everything, because they have to. And then we'll hold that information and then see where we wind up. And we also know the thing that everybody on this in this live call knows, which is that people are thinking about 12-month horizons, 18-month horizons. Even as a community, like our leadership, we have announced decisions 3 months or so at a time, and not much more than that. And actually, that's been intentional. It's like people need to. It's the grief. Grief takes time to work through and process and hold. And if we're trying to announce something about 18 months from now, people just aren't there.
How are you seeing this play out as a congregant and an expert in this field, Ross?
Oh, I miss my congregation a lot, and a Zoom service is just not the same. I mean, you get the message, but you don't get the community. And if you're a community first sort of person, the message is only so much of the story. It's the it's the interactions, it's the people. And I really miss the people, because that, Sunday morning is my fix of my peeps, the people who think like I do, where I can just say things, either political or religious, and I can be comfortable because I know people know me, and I know the environment, and I know the culture, and I know the folks. So it's hard, and not knowing when we're going to get back to it is hard. I mean, I think you're talking about grief. It's a real phenomenon, and so as a congregant, I feel it too. And I now kind of keep the time frame. I also think about the fact that we probably need to donate a little bit more, because I'm lucky. My salary is continuing just fine. A lot of people are struggling. We have to be there for our congregation, because this is a time that we can step up through different ways. We can volunteer for things in different ways, because I'm here. Normally I commuted back and forth to Washington. I'm here now. So we're trying to figure out ways that we can contribute to something that we value very much, that has been valuable to us, so that we can make it valuable to others.
Quiana here. I had a question for Don, and maybe a little bit for Manish or myself. What are some things that your community has done to keep that sense of connection? When Ross was talking about the people piece, it made me you know, he spoke a little bit about the ways that now I'm here, I can check in. What are some things that have happened in your communities? I guess we could all answer this, that have helped with the human piece of the reality of COVID. So I'll turn the mic over to whomever wants to speak.
I can talk about that for a little bit. We've had a different levels, like any congregation, of computer literacy, of computer fluency, and some of our older folks. I'm thinking specifically of a number of folks in the book club and a number of folks in the women's group really struggle with computer stuff, and some of them don't have computers at home. And so what those groups have done is they have found an outdoor pavilion place, right? A picnic area that's under a big roof, and they're holding their meetings there. They space their chairs 6 feet apart so that they're outdoors and they can still see each other and connect, and that's working for them. We've had a couple of other folks and families and small groups who are close friends who have formed contact pods. Like this is like, we've got, I'm thinking about, we've got one couple that's in their 80s and another friend who's in her 80s, and they're close friends before, but they've agreed now that we are the only ones who are going to see each other, be in the same room with each other, right? Share that kind of space. And by agreement, they're going to be, that allows them contact with each other in a way that's more intimate than being outside in the park 6 feet across from each other, shouting about this month's book so that everybody could hear. And so that I found, like, I went off, you know, for summer, I went away for a break, I stayed here, but, you know, I was out of touch. And I came back and I had found that this is how they developed their own ways of coping. And another thing that has happened is our membership committee has created a list of people they have designated as computer challenged. And the person who helps with the outreach and the newsletters and the weekly stuff, she and I are working together to figure out the best way to reach those folks by snail mail. Because if they don't have email, they're not getting the midweeks, you know, and we haven't printed a monthly newsletter since March, right? That they would normally pick up at church. So they've got to be feeling really isolated. We've, you know, tried calling by phone, and some of them are elderly and they don't hear terribly well. So, I mean, it's a real challenge to get people connected. And so it's turned into this sort of hybrid of what can we do with all of the modern science stuff that we know now, and going back a generation of technology to snail mail to address a need that we can't do any other way. So it's yeah, the present and the future are going to be hybrid for a lot of us for a while.
So I can speak a little bit. So at the very beginning of COVID, we created I was the pastoral care coordinator, and we created a system called Q Buddies. So we took folks who were maybe isolated in our community that we already knew and partnered them with someone else. And they did that for about 12 weeks. And so I'd send an email every other week and say, you know, did you call? Maybe you should send postcards. And give folks ideas about ways to engage, such as maybe you guys could do a recipe exchange and, you know, make casseroles and put them on each other's porches, or, you know, that sort of thing. There was some art places that were giving free museum tours. And so just putting people together just to check in once a week. And it ended up being this beautiful friendship. Some of them are still going on, and we're actually going into our second wave of quarantine buddies. We call them Q buddies, through pastoral care. And it's actually just really this beautiful thing. We have a member who lost their wife last year and moved into a different care facility. And then we had an older congregant who were there, and they partnered up, and now they walk every day. So you've got like this, like, she's maybe 90 plus, and this other gentleman who's about 65, 70, and they're walking every day, and they're our members, and it's beautiful. The other thing that we did to prepare folks for the year is that we did a series of programming called Welcome UU Back Week. And in that, it was spread over 3 weeks. And so it was really neat. We did, intro to Zoom. If you're going to host on Zoom, what does that look like? What does stewardship look like this year? What does intro to membership look like? And then a lot of spiritual growth and development. It was an opportunity for folks to engage our programming. It was like, what happens in the social hall, and how do we replicate that in a healthy, sustainable way? And so we've really tried to do a lot of work around replicating what we can, where we can. We know it's not the same, and we honor that. And I think there's a lot of beauty in just saying it's not the same. Instead of trying to, for me personally, I'm not trying to get back to normal. I'm trying to get back to things that affirm who I am. And that shift for me has just been super important in my own mental health. If I'm always trying to get back to whatever I was doing on March 12th and not what sustained me April 20th or July 25th, it just puts a lot of energy into things that I can't get back to. So I'm really focused right now on creating program in my physical brick and mortar community that's sustainable over the long term and prepares us for what's next when we don't know what next is.
I've been appreciating since the early days of the pandemic, and I wrote a little bit about this back in like April. It really brought up a lot of the, I guess, I didn't even know that I was holding trauma from coming out in the early 90s in the midst of the AIDS epidemic, which, AIDS hasn't disappeared, it's still around. But in the absence of effective treatments, it was a certain very heightened level of constant anxiety. More than anxiety was fear. And there was some, on the other side, I had to work through all of that reemerging and resurfacing in this very strong way, this thing of like not knowing who might be holding illness that they themselves don't recognize, right? Like all of that was coming up. And on the other side of that, working through some of that reemergent grief, trauma, whatever, there's wisdom from some of that experience too. And one of the things that's been resonating, like one of the things we learned as gay men in that time period and still, is consent-based risk, like actually being deliberate, having intentionality around taking risk with your health, as opposed to having risk imposed on you, right? Like there's profound wisdom in empowering people to let them decide that they want to take risk with their health. And everybody's had conversation about it with one another, right? So like we were very strictly quarantined as a family. My daughter, who's 6, is a over extreme extrovert. And by June, it was too much for her. It was actually becoming unhealthy. And close family friends said, well, talk to 1 or 2 other families, talk about what behaviors are like in each of your families, arrive at a consent-based understanding around play dates. Great, we did that. It helped. I still feel nervous. I still don't feel like 100%, but that's the same thing, like safe sex in the gay, that era of the 90s. Like it's not risk-free, but it's highly consent-based. We understand what we're entering, right? And so I'm seeing that being some version of that being replicated in community life. Like over the summer, we had a small number of like groups of 5 to 10, 12 people. They're not meeting on site in our building, but they were choosing to do activities that were, congregational activities, sanctioned activities in other locations. And what we've been guiding them, we have a COVID advisory team, as do most congregations have some kind of team that has science experts or public health experts on it. We do. We have since March. And they run their little safety plan. It's consent-based. Everyone has to buy in, have the same conversation, the same set of agreements, and then they can do something off-site. And there's a wisdom in that. I've just started to have that level of conversation with my co-worship leaders around like, well, we at some point in time, we're going to have consent-based discussions and decide whether we're okay being in the same room together and live streaming or filming worship together near each other, physically near each other. And it requires consent. You know, so the thing that I'm finding I personally, as a human being, am not comfortable with is being thrown into situations where I don't know the level of risk of the other people I'm around. So imagine if you show up, if 50 random people just show up, you have no idea what their behaviors are, what their safety precautions have been prior to showing up in this room. Like I find my anxiety level goes through the roof. I've been in that situation, even outside on public playgrounds. I have to leave. I'm actually not comfortable. It doesn't feel okay to me. So I do feel okay with intentional consent-based interactions though.
I just wanted to chime in and say that's so important, Reverend Manish, because no one's living risk-free, right? If you open your front door, there's a level of risk, right? And it may be small or big, but we are not living a risk-free situation. It's a risk assessment moment. Every time we choose to interact or leave our home or have someone deliver groceries on our steps even, it is a risk and one we have to calculate. I did not grow up in the same era that you did or not far behind it, but I think the things that I understand about disease prevention and contact and consent all come from my sexual health education, right? Like I understand it from that perspective that even though I'm a single person doing something, I could have a bubble of people that reaches 3 or 4 out without me knowing it. And I think we lived in a world on March 12th that taught us we were living risk-free. And that just was never my reality as a Black woman, queer woman in America. I was never living risk-free. Like that was never my options. And so I think it's also really easy for me to slip into risk-based. How much risk is this? Who am I risking? Who do I want to take along on that journey and who can't go along with me on that journey, and making decisions based on that. Dr. Ross, I wanted to bring you back into the conversation and just talk about risk. What does if you had to say you were at a brick and mortar, what would it look like for you to say, we are ready to reopen? What are maybe 5 or 6 things folks can maybe look out for? Not an absolute, but just an offering of things that they should consider when making choices about gathering again.
Okay, well, things you might consider is what's the rate of community transmission? So you can know how much spread there is in the community, which typically means that people don't know from whom they got it. The contact person who was the infectious source is not known. It happened in the community. So you want to reach a point where community transmission is very low. You want to reach a point where you're willing to accept that there's going to be some spacing. That when you get together, you're gonna maintain that spacing. That the hugs that you really want to give, the handshakes you really want to give, you're probably going to have to hold off on that for just a little bit. Singing, you're probably going to have to hold off on singing for a while, because it only takes one person singing who's infected to infect a whole bunch of people. There have been several cases where that has occurred. So, you got to be ready to make certain adaptations. Coffee hour might be better outside than in the close together meeting hall next door to the sanctuary. I mean, you're going to make some adaptations, but it's probably worthwhile, because that human connection really is worthwhile. So striving to get there, striving to get the rate of transmission in the community low enough, and then being willing to do those things that keep you safe in as much way as you can through the wearing of masks and social distancing is a good thing that I think we as a group should be able to figure out how to do.
What are the people that you talk to, the public health experts and doctors, saying about things like quarantine pods and the things that Manish was saying about consent?
They're a great idea. Having a group of people who are you agree to be hermits together is a really good way to maintain some community. And my example is my kids live 5 miles that way, 5 miles that way. We all basically work from home, and go to the grocery store. And otherwise, when we get together, the kids play. My wife is providing the educational experiences. She's being the Zoom teacher for 3 grandkids. And so they get together. So I think the idea of a pod is perfectly, because you're looking at what's the relative risk. Now, if something happens to somebody in one of these pods, like they do get exposed, we're expecting them to say, I did something that put me at risk. We're going to wait for 10 days before we get back together again. That's part of the rules of the pod. But otherwise, it's a good and a safe thing, and a good, sane way to help provide that human interaction that we as a species need.
We did potting as well, just for our kids needed to run and play. Like they're 10 and 12, and they needed to be outside. So we created a pod over the summer, and that was a risk that we took because they needed other kids so bad. But we did that risk assessment. We talked about it. I have a co-parent. We parent together, but we don't live together. So we had to really make those decisions and assess that risk. And so I think it really is important. I guess what I wanted to say is that whatever got me through the first 6 months of COVID isn't going to be what takes me through this next 6 months. So I've had to do some re-risk assessment, decide to add people into my circle because I'm lonely. And so it was like, can we add people? Like, great, I got my 6-month badge, but now I need a different 6-month badge. I cannot go a year without a hug. That's not normal. That's not how we survive. That is how you get skin hunger. That is how you die. So it has been this kind of like, all right, this isn't going anywhere. Who's in my pod now? How can we widen the circle and take care of each other in the ways that we haven't been able to this last 6 months? It's so important. And for kids, their mental health is so important to have other people.
I feel that too, because my 7-year-old is also a off the chart extrovert, and we live in Westchester County, New York, which is where the outbreak first popped up on the East Coast. And so there was a period that you talk about if you open the front door, you're at risk. And there was a period of, it was a good 2 months where we didn't open the front door. My car battery died, and because I didn't even go out to start the car. I was afraid to leave the front door of my house in Westchester County, New York. So Manish, you have a question for Ross?
I do, Dr. McKinney, and this is interesting because AJ Van Tyne in the chat just posted a similar kind of wondering. I had to work towards these pod-based understandings that you just described, that Quiana described, that I did too, and that was not easy. Let me tell you, even just from the immediate family unit, it was clear to me that it's taking risk. And we were clear, like the only thing that made that okay was in-depth conversation, right? Which is similar, again, exactly what I had to do in the AIDS era of the 90s, in-depth personal conversation. So is there a cognate for that? Does that translate into larger activities with some kind of practice? That's kind of what I'm wondering as a congregational leader, because I feel like the moment we get to an event that has 20 people or 50 people or something like that, that process that leads to a pod, I don't know how to replicate that. And do you have any thought? Because the thing that freaks me out is that like 20, 50, whatever people, here I'm speaking as a human being, but it's also care for my community. Like I don't know of how to assess who's showing up to a public event. Even if everybody's choosing to be there, there's actual conversation about individual or family unit health strategies isn't possible. What would you suggest or advise?
I think actually you have already given the answer, I'm afraid, which is you can only do it when there's a level of trust that people agree to certain behaviors that make it so that they're not particularly at risk. And if you can't get that agreement and honor that and understand that somebody's going to honor that, it's not going to work. And the larger the network gets, the harder it is for everybody to agree to those rules. Because you could have a pod of 500 people, in fact, who all honored the rules, never went out to the grocery store, never went out to eat, never let people into their home who weren't wearing masks, but the trick is it only takes one who violates that, and the whole thing crumbles, because you're doing in that pod is sort of agreeing we're creating a safe space together. And so if people, you have to be very, very careful that you know the people who are in that pod. And I think that the larger it gets, the harder it is to have the depth of knowledge that you need for it to work.
Oh man, I had something really smart to say. I remember. One of the things, we've got a couple of things happening with the demographics at my congregation. We are also in a university town. Stockton University is a relatively small state college, state university right across the road from us. So we have a number of faculty and staff and stuff who are members of our congregation. We also have Atlantic City, 15 minutes away, with all the casinos and all the tourist stuff and all the everything. And so that's a different culture. But what's happening now at Stockton is every time faculty or staff or anybody comes onto campus, they have to fill out and sign a statement saying, I have adhered to these specific protocols and these behaviors, and I have limited my risks in these specific ways, and I pledge to behave in these specific ways while I am here on campus. The local medical health provider, the local Atlantic Care system, right? It's, you know, that conglomerate sort of network of things, requires that of all of their physicians and staff and nurses and techs and everybody else every day when they come in. So those are also all kept on file according to date and event and place, so that if somebody comes up positive, it makes contact tracing all that much easier. Because you can say, where were you? Well, I went to the doctor and I went here and I went there and I went, you're right, okay. It's okay, you went to the grocery store. We're forget that. We can't figure out that. But you went to church and you went to this meeting and you went to this class. Okay, we now have a record of who was in that room, right? And it helps that on our COVID safety planning team, we have a family physician and a microbiologist from Stockton, right? So they're being super helpful in this stuff. And both of those institutions have created that system for verifying or for attesting to individual behavior. And so one of the things that they're developing is a form very much like that, a paper form that people sign, and they check the different boxes. So they have to opt in on each one for any time we have in-person events, even the ones that are outside at the canopy thing, right? At the what's the word?
Park.
Yeah, it's park will work. Yeah, but the pavilion, that's a thing. Yes. So when we get to a place where we're having events in the building, because it's now October, and the book club that's in a meeting all summer in the park is, you know, the first cold rain of November, they're going to start thinking, well, maybe we can move this indoors, right? So we're having a system set up with that kind of, yes, we're asking people to volunteer that they've done this stuff, and we're trusting people when they sign the thing and say, yes, I've done this. That's as much as we can do, you know? And then because we're still a family-sized church, you know, the relationships are such that if anybody comes up positive, everybody's going to know in a flat hurry, you know? What am I seeing here?
So we've got a robust conversation happening.
Yeah, that's
and we have 5 minutes left, so we just want to say, Shige and AJ, we see you. Thank you, and it's true. to have a variety of things happening. I've said to I serve a bricks and mortar congregation in addition to the Church of the Larger Fellowship. And I've said to the congregation here in Mount Kisco, I said, we can try on things. We had a tailgate party in the parking lot. One of the things we are blessed with is a parking lot large enough that, 40 families could park three parking spaces away from one another and set up, lawn chairs and have masks on, and we could actually just be physically in the same parking lot as one another, but not have excess risk. I mean, no one went in the building. It was great. But I've said to them, I said, the very last thing that will look anything like it used to is worship. Because the very most dangerous thing we can do is all be in the same room, breathing the same air for an entire hour and talking and singing. It's like the very most dangerous thing we can do as a community of faith. So that's going to be the last thing. And they
worship is
sad.
Right up there with the risk level with rave or rock concert, right? So
with 4 minutes left, Ross and Manish, I'm wondering if you have any last thoughts you want to share with us.
The only thing I was thinking, I was so grateful, Don, for your sharing kind of what some of the scientific folks in your community are doing. The thing that I kept thinking is, self-reporting. Our family physicians would tell us that, the little boxes where we ask people how much they drink per week or smoke in a month, notoriously human beings underreport health risk, right? We know this, it's well established. So I don't know, just knowing that, and that we have a poor track record as a species of reporting our own risky behavior voluntarily to strangers, right? Or relative acquaintances as opposed to a best friend. So I don't know, that makes me a little nervous as somebody who's cautious about my own health. But thank you. I mean, I think this is very complex. It is the question of our time, how we're holding community together. I feel a constant level of anxiety around wanting to provide the level best for my community. I love my community so much, and I want to hold us together. I want to provide the best that I can, that all of us can provide, and it's hard. There are no clear-cut answers. Nobody is an expert on the intersection of COVID and congregational life. We're all figuring this out together.
Thank you for saying that. I'm struggling with the same thing. I miss my people. I miss them so much it hurts. And I don't want to bury any of them. I've got, the average number of octogenarians that a small congregation will have. And I don't want to bury any of them. I told them, look, I would love to, have a long, healthy ministry and retire in 15 years and have buried 2, which puts a little pressure on our 93-year-old. Yes, but, I don't want to, you have to look around and say, okay, who are we going to lose? I just can't do it.
I want to thank you all. Go. No, Ross, I want you to close.
Well, I'm just going to say, I'm also looking forward to when we're going to be able to test much more efficiently and cheaply. That when little cards that you can actually test and verify that you are well before you go off with people is going to change things a lot. And I am hopeful over the next 6 months, those kinds of easily distributed, more facile ways to screen people are going to become available. And I don't know whether it's going to be, you stick a swab in your nose and put it on the card, or you spit in a little thing and it tells you whether it's blue or green. Something is going to come along that's going to give us a little bit more freedom, because you're going to be able to know and test that somebody is not contagious in a more efficient way. So I'm looking forward to that. I think there's hope for life getting back towards normal through a variety of different means, some of them technology, some of them behavior.
Michael, you want to close us out, or you want me to do it?
Go for it, Quiana.
I'm talking, I'll do it. So we want to thank you all for being here. It's midday. Folks have things that they need to head off to. Here at the VUU, we care about you. We'll be back next week with some other stunning topic that will just dazzle you. Until then, take care of yourself, find your people, and feel loved on, because you are loved. Thank you all for your time and your energy. Dr. Ross and Reverend Manish.
Thank you.